Hi, I'm Dr Sulaman Anwar and I'm a specialist periodontist based in London. So the challenges patients face are quite a lot. There's quite a few things that patients struggle with, and with periodontal disease, we know that the teeth are quite mobile. That's something that patients will always struggle with, so the teeth end up moving. Pockets are always hard to reach, so patients will struggle to get to the base of where the bacteria in the food is depositing. One of the other things patients really struggle with is the fact that they've got gum recession. So with gum recession, it's always more difficult to brush on the tooth surface, but also the gum can be quite sensitive. Patients with gum disease often suffer from a lot of inflammation, and using the toothbrush on the gums can be quite uncomfortable, and when they see bleeding, they kind of get worried, and that prevents them from actually cleaning their teeth properly. So there are various different treatments for the varying degrees of periodontal disease, but by far the most important is toothbrushing. Removing plaque from your teeth is essential, and if we can focus on that, we're less likely to have gum issues. So I think preventative care is very, very important. A healthy patient will always have a healthy mouth. So the whole thing is to motivate patients not to have an unhealthy lifestyle. So if we've got a patient that is eating well, exercising well, cleaning their teeth well, they're less likely to have gum issues, and that's of paramount importance. So for me, I think patients, what's essential is that patients are using the right instruments. So we've got a good electric toothbrush, a good tongue cleaner, a good mouthwash, a good toothpaste. These are essential things that patients need to be using. They need to be cleaning in between their teeth, but also cleaning their teeth effectively. And if we can train patients to do that well, then we're on a winner. So I often am very careful in terms of what I'm recommending to patients, and I like evidence-based. So for me, I think it's very important when we're looking at a product, for example, like the Philips toothbrushes, there's a lot of evidence backing up what they're stating, and that's helping patients. Patients also like to use something that's very easy to use, and the toothbrushes are very light. The toothbrush bristles are a lot lighter. They penetrate a lot further in compared to previous brushes. I find that holding the toothbrush is a lot lighter, and patients appreciate that as well. I love the fact that there's an app so patients can actually monitor their progress. We can actually support them with their progress, and I think that's essential for getting a motivated patient to do even better. So with gum disease, we always find that patients are very susceptible, so we have to work out what works best for them. And I find with the Philips toothbrush, it's a lot lighter to use, it's a lot easier to use, it makes a lot less noise, and patients often complain about electric toothbrushes making too much noise. There's a pressure sensor, so patients aren't damaging their gums by using an electric toothbrush. There is sometimes a misconception that they can be quite abrasive, but actually with Philips, we find that they're a lot softer and there's no damage occurring.